A few days ago, I went to work for the first time since the WHO declared us to be in a pandemic and the US declared us to be in a national emergency. So naturally, I did a few things I don't usually do. I shaved. Usually I have about a week of facial hair or sometimes even a beard, but I can't wear a proper mask with any kind of stubble or facial hair. I meditated. I've been more anxious than I have been in a long time, and meditation actually really helped. And I called my parents. I mean, I usually call them, or they call me about every week, but I pretty much call them every day now. Right now, things are ramping up in our hospital, and I think we're well prepared. So there's nothing left to do but to take this one day at a time. When I look at what's going on out there, when I talk to my friends, my family, I get the sense that people are confused. People are scared, and that's not good. I think that's because on the national level, we have very confusing messaging. On the one hand, we were hearing for quite a long time that we've got this under control, this will all go away. And on the other hand, you have states and local governments putting people on lockdown. There's nothing left in the grocery store. Even the NBA canceled its season. Also, my friends are sending me what they're seeing on Instagram and WhatsApp, and a lot of it is totally wrong. False information about where the virus came from, how it's spread, false information about the level of government response. So I feel a sense of responsibility as a doctor, as someone who's seeing what's happening on the front lines of this pandemic, to try to help people understand what's going on and how to be as prepared as possible. In this video, I'm going to give you an insider's perspective on what it's like to work in a hospital during this pandemic. First of all, who am I? My name is Shri. I'm a board-certified internal medicine doctor, and I work as a hospitalist. What that means is I take care of people who come into the emergency department who have to stay in the hospital for treatment of their medical conditions. So for example, if you come into our hospital with symptoms of the coronavirus, there's a chance I might be taking care of you. Before I get into life in the hospital, I just want to set some ground rules. I am a medical doctor, but this video is not medical advice. If you have any concerns about how you're doing, you need to call your local health system for advice. And I will not be talking about any confidential patient information. Okay, now that that's out of the way, let's get into it. What's it like to work in the hospital during a pandemic? At the moment of this video, Los Angeles County has an official count of 231 patients with the coronavirus and 2 who have unfortunately died. That doesn't sound like a lot because it really isn't. Across the entire United States, there's approximately 11,000 cases right now. And as epidemiologists are telling us, we're almost certainly underestimating the total number of cases there are. By the time you watch this video, I guarantee these numbers are going to increase. Right now, we have extremely limited testing in the United States, and the numbers that you're seeing are more likely the tip of the iceberg rather than a complete count. Why is it that the US is so behind in testing, especially when places like South Korea can test about 10,000 people a day? Early on in the course of this pandemic, Germany developed a testing protocol that the World Health Organization adopted, and that test is now being used by about 60 countries around the world. The United States decided not to adopt this test, which in fairness is actually usually what happens. The Center for Disease Control and Prevention, or the CDC, is usually able to make their own testing. Unfortunately, there were setbacks, and the test that the CDC developed was no better than a coin toss. Because of that limited testing, we really don't know what to expect at our hospital. That's almost certainly going to change when tests from abroad arrive and when the US develops its own effective test at scale. And once that happens, we'll have a much better sense of what we're dealing with. So far, the number of cases that LA County has been dealing with has been relatively small, and we've been able to treat those people effectively. Outside of actual patient care, there's been a lot of meetings and briefings and just getting the hospital ready. I feel pretty safe with the equipment that we have. If there's a suspected case, you have to put on a mask, a face shield, gown, gloves. Basically, your whole body is covered. We know from research out of China and Germany that this virus is spread through droplets. That means when an infected person coughs or breathes, they leave some viral particles out in the air. Those respiratory droplets will hang in the air and settle onto whatever surface is around them. Because of that, it's critical that we wear all that protective gear so that we ourselves don't get infected and that we don't pass the virus on to others. Now, with all of that confidence I have in our hospital and our equipment, there are a few things I worry about, not just for us, but for pretty much any hospital around the world. Those masks and gloves are critical, and we have to find a way to get or make more. I am encouraged that the United States government is taking this pandemic more seriously. I just saw that the Defense Production Act has been invoked, so hopefully we can use existing manufacturing infrastructure to make what we need. Another thing I worry about is during all this, it's not like people are going to stop having heart attacks or strokes or car accidents. I do worry if we get overwhelmed with COVID-19 cases, what happens to all those people? Well, it's not just me that's worried about that. This is the whole idea behind Flatten the Curve. Basically, if we can all practice social distancing, isolating ourselves in our homes except for the absolute essential things like getting groceries and medications, and staying at least 6 feet away from other people when we're in public, we can hopefully slow down the rate of infection so as to not overwhelm our hospitals. That's actually pretty empowering when you think about it. Every single one of us has an impact on how long this pandemic lasts. If you can, post a picture of yourself with your quarantine partners on your social media with the hashtag Flatten the Curve. By getting the word out, you can actually save lives. Besides everybody at home doing their part to slow down the virus, how can we take care of all these people who come in? In California, the state government is trying to expand the number of hospital beds that we have available. The state is planning to open 2 non-operational hospitals and is coordinating with the military to open a hospital naval ship and mobile hospitals. So yeah, so far it's been a calm storm while we wait for the actual storm. Because of the fast-moving nature of the virus, I know this video is going to be out of date pretty much as soon as I make it. I still think it's important to try to get the word out in whatever way I can. During all of this, I'm going to be making as many videos as possible while updating you on how we are coping with this pandemic. Thanks for watching this video. If you like what you saw, please send this video to your friends and family. Also, let me know in the comments what questions you have and what you'd like to see me talk about. Until then, stay safe, stay well, and I will see you soon.